So at this time, I am pressing the live button. So Shania, it's over to you.
Amen. Thank you.
Hi, good evening, everybody, and praise the Lord. Thank you all for joining in on this presentation. As you're aware, tonight we'll be talking about staying healthy in the COVID 19 pandemic and going into this cold and flu season. So, first off, I'll start a little bit by covering some of the points that we've previously shared in the church newsletter, some of the tips that were recommended for COVID-19, and then we'll move a little further into some other details. So first off, COVID-19, as you know, spreads most commonly via respiratory droplets. It can also be airborne, and it can also be picked up by surfaces as well. But mainly respiratory droplets are transmitted from person to person, or they can also be transmitted from person to animal. And basically, when you get those respiratory droplets, they're either inhaled through your nose, they come in through your mouth, or they can come in through your mucous membranes of your eyes, and they're transmitted to your lungs. So once it gets into your lungs, that's where you basically that's where the virus tends to thrive, and that's where it replicates to actually cause its primary infection. The prevention points that we've sort of gone over in the church newsletter include washing your hands at least 20 seconds with soap and water. This is especially important anytime you have been out in public places, when you're going to the bathroom, anytime you are eating, as well as when you are taking off your mask. It's very important to try and sanitize or clean your hands before you take your mask off. And for the 20 seconds, sometimes it's hard to count 20 seconds. So some of the recommendations are for kids, they can sing their ABCs. And for us adults, we can sing happy birthday, the standard happy birthday song. And that usually gets you through your 20 seconds. You also want to remember not to touch your face, especially your eyes, your mouth, or your nose. And please wear your mask over both your mouth and your nose. It's really difficult to see people out in public, especially sometimes if you go in the grocery stores and their mask may be down underneath their mouth or down under their chin, or maybe just covering their mouth and not covering their nose. But when they're doing this, they're not protecting themselves and they're not protecting others. So that's very, very important to cover both your mouth and your nose. When we're social distancing, sometimes it's not just meant for us to social distance out in public, but also as well in your home. So if there's somebody in your home that's sick, it is important to also socially distance in your home, even when you have your mask on. You also want to make sure you're covering your coughs and your sneezes, predominantly with your elbow or tissue if you are able to get to a tissue, and cleanse your hands even if you don't sneeze or cough in your hands after you have actually produced respiratory droplets. Make sure you're cleaning and disinfecting any surfaces, particularly the common surfaces like your door handles, doorknobs, light switches, countertops, which is especially important after you've gone grocery shopping. And monitor your health. Only you know exactly what your normal health status is. So typically by the time that you become an adult, you can sort of tell when your body is telling you that you have a fever, or if you're feeling extremely tired, if you're having signs of, or if you're having a cough that you don't typically have, or any type of shortness of breath or difficulty breathing. These are the three main things that you really, really want to monitor yourself for. So those are just some review points, the things that we've pretty much already covered in the previous church newsletters. A few things that I want to bring up about cleaning and disinfecting products. The U.S. Environmental Protection Agency does have a list available on their website that covers many products that are said to kill COVID-19. And usually, if these products are on the list and they can kill COVID-19, then they work against many other viruses that cause the common cold or influenza, which causes the flu virus. So, this list is not only helpful for COVID-19, but also for knowing what to use going into cold and flu season. Usually on products, there's labels with instructions on how to use them. So you want to make sure that you're using them appropriately. for cleaning whatever surfaces are actually listed on those labels. And there's also something called a EPA regulation number. This EPA regulation number is what you would basically reference on the EPA's website. So in my presentation, I've provided the website along with the actual tool where you can put in the first two sets of numbers that you would find on the label of the product that you're attempting to use to clean with. And then on that list, once you put in the first two sets of numbers, then you know for sure if anything else that you're purchasing with those two sets of numbers as the starting numbers are a product that works against COVID-19. So in my presentation, I included an example, but for some people that are tuning in by phone call, I'll just kind of read it off. So for example, if the number on the label starts out as 12345-12, and you put that into the list on the EPA website, and it comes up as a product that is approved for killing COVID-19, then you know that any other product with that beginning two sets of digits on its label is approved for COVID-19 purposes. So, and again, if it works for COVID-19, then you can trust that it most likely works on any viruses that cause the common cold or that cause the flu. So how long can COVID-19 actually remain on surfaces? Well, for most of the studies that have been done, it's variable times only because these studies are done in labs, so they're not able to actually reproduce real world exact conditions. So depending on things like ventilation, humidity, and temperature, COVID-19 can vary on different surfaces. But the one that I really wanted to point out was plastic or stainless steels, being that when we grocery shopping, most people put their products into plastic bags in the grocery stores, and a lot of people have stainless steel in their house. So COVID-19 can last on these surfaces specifically for 2 to 3 days. So with your plastic bags, if you're sitting them on the countertop, you want to make sure that you're wiping down those countertops after you take those plastic bags off. And if you're planning on keeping those plastic bags, either you're keeping them out in the sun or in heat for 14 days, or either you have some type of cleansing method if you're going to be holding on to those plastic bags. And for the stainless steel surfaces, just make sure that you're wiping them down frequently, especially because 2 to 3 days can be a long time. So in the presentation, I've included a little chart that gives you a comparison of symptoms that you can present with and when you have a cold versus when you have the flu versus if you have allergies or if you actually have COVID-19. Now you'll see in this chart, there's a lot of overlapping symptoms. So sometimes it's hard to really distinguish, well, does a person really just have allergies or do they have the actual flu? Or does someone have a cold or do they actually have COVID-19? If you kind of go through each column of the chart, you'll see some of the things that are listed, like for example, chest pain. Chest pain you may only see with COVID-19 and the flu if the person has a severe case of COVID-19 or the flu. Or with shortness of breath. Well, for shortness of breath, you know that if a person presents with that, then it's going to be a little unlikely that they have a cold or that they have the flu. It is more commonly seen in COVID-19 cases. With something like a sore throat. A sore throat is more common with the cold and the flu, but it has also been reported in some COVID-19 cases. So these are just some examples. There's a lot of overlap again, but you know, if you have any of these symptoms or present with any of these symptoms, we'll go over this, but you want to know at least what to do when you present with these symptoms, or if you have any of these symptoms, or even if you know somebody that has any of these symptoms. For the flu, since we're going into cold and flu season, one of its main distinguishing factors is that the person typically presents with a very high fever and extreme joint pains or muscle aches. Now, while this can also be something that presents in COVID-19, it's not as likely as it is seen with the flu. So that's one of the big distinguishing factors between the flu and COVID-19. So if you do feel like you have COVID-19, what do you do? Well, as we already know, the first thing is you want to make sure that you are isolating and quarantining for at least the 14 days at minimum. I also recommend, and it was also recommended by the CDC, you just want to make sure that at least someone that you're really close to knows that you are experiencing symptoms of COVID-19. Whether you video chat with them, whether you phone call them, email, whatever it is that you can do, send a text message. You want to make sure that somebody is aware that you are feeling sick or that you're not feeling well, and do not isolate yourself in that capacity. So yes, you do want to isolate yourself in terms of being in a room by yourself, being home by yourself, but at the same time, you want to make sure that someone knows what is going on with you. If you do notice that you have any of the symptoms that are included on the COVID-19 list, make sure that you get tested. While some tests are more accurate than others, depending on how they are or what they're testing for specifically based off of the virus, you want to make sure that it's confirmed that you actually do have COVID-19. Even if you do end up with a false negative, it's better to know and to get the test done, so that way you are trying to not only protect yourself but protect others and those around you that you love. um it is not recommended that you go to the hospital unless you are experiencing severe symptoms. So what are the severe symptoms? The one of the most presenting severe symptoms is shortness of breath. And now we're not talking like, somebody who just runs around the block and just gets winded from doing a short workout. We're talking somebody who is sitting at rest, sitting in a chair, and they are struggling to breathe. You can see their chest possibly moving up and down, and the ribs basically retracting in because they're really, really struggling to just even catch their breath sitting down. So this is somebody who has a severe symptom of shortness of breath. If you're experiencing severe chest pain or chest pressure, then you would want to go to the hospital. If you or someone else that you see that you're with has blue discoloration in the lips or the face, they're confused, you're unable to get them to arouse or come to, these are the people that need to be taken to the hospital, or you need to call 911 for them. And why is this so important? Well, COVID-19 basically can cause a lot of complications. And the predominant reason why it causes a lot of complications is because of something that is released in your body called a cytokine. A cytokine is basically like an immune modulator. So it causes an inflammatory reaction in your body. It's produced or released by your immune cells, which normally typically help to fight for you. But in the case of when you're sick or when you have a virus like COVID-19, it's in that case fighting against you. So here I listed some of the complications, which can include like severe respiratory distress syndrome. You can have acute respiratory failure, pneumonia. It can affect your liver, causing liver failure. Your kidneys can go into acute kidney injury. You can experience sepsis and even blood clots. People have gone into stroke status in the intensive care unit just simply from getting a severe case of COVID-19. You also can have something called muscle breakdown, where basically your muscles start to break down your blood cells and you start to see like basically blood or a red discoloration of your urine. So if so facto you do present with any of the early symptoms of COVID-19, it's important that you take care of yourself. The best thing that you can do is rest. Keep yourself hydrated with as much water as possible. Don't stop eating. And over the counter pain medications are okay. I know that there have been a lot of different studies, ideologies about what types of pain medications are okay and which ones are not. There was something out previously that once said that ibuprofen wasn't okay, but it has now been, I guess, researched, and it is an approved pain medicine to use. But acetaminophen or Tylenol, any of those over-the-counter pain medications can help. with the pain that you may feel from COVID-19. Laying prone basically just means laying on your stomach or your chest. And this is something that has been shown to help, especially in the hospital setting. So if you present with early symptoms of COVID-19, it can help you to basically clear any secretions that you may have in your lung or any phlegm that you may have in your lung, and help the viral particles to get to kind of travel out of your body. It also helps to redistribute your oxygen basically that's within your lungs, and to help you to clear the virus out of your system. You also want to make sure that you're still maintaining your daily routine. So that may be difficult because you're feeling tired, you're feeling weak, but you still need to make sure that you're not just laying in the bed all day, that you do get up and at least try to, shower and keep up your daily activity. Some of the symptoms of COVID-19 can linger for even weeks beyond the 14-day period, like fatigue or cough. People have gone into extreme fatigue syndrome, which basically they're just feeling extreme tiredness even beyond the 2-week period. And some people believe that, reinfection is not possible, but it actually is. The immunity with the basically that's created by your immune cells called antibodies in your body can last for up to 3 to 4 months. So in that like window or time period, you have somewhat of a protection, but that does not mean that you can never get COVID-19 again, or that you can't contract coronavirus after that immunity period has kind of has basically waxed or waned. Okay, so moving on to the cold and flu. Some of the prevention points for cold and flu overlap with COVID-19, but both the cold and the flu, just like COVID-19, are spread via respiratory droplets. So that's what makes these viruses so potent and powerful during this season, is just because you can get them all by either coughing on someone, sneezing on someone, or even just talking to someone and having a simple conversation if they're sick. So again, you want to make sure that you're limiting your contact with any sick individuals. If you have to sneeze or cough, again, cover yourself with a tissue or with your elbow. Wash your hands as often as possible. Avoid touching your face, and make sure you're cleaning and disinfecting frequently. So another point is that you need to keep an adequate amount of certain items available to yourself in your home and at work. This also does apply to COVID-19, even though it is, a prevention point for cold and flu. But you want to make sure you have adequate amounts of tissues, adequate amounts of soap, paper towels, alcohol-based hand sanitizers with at least 60% alcohol percentage, disposable wipes that are like, the disinfectant wipes, and also disinfectant sprays. All of these things are things that you're going to need for at least the next several months, even going into next year. So what a good practice to make is, as you're seeing these things in the store, if you have a little extra in your budget, go ahead and grab them, because no one can predict or say when these things are not going to be available, when they are going to be available. There's been a lot of worry, and people get concerned and things end up not being available. So it's important to grab them as you see them in the stores as much as you can. That way you have a surplus of supply, and you never know if someone is going to be also be in need. So if there's another member in our church that may be in need and they weren't able to make it out to the store to grab something, then you'll already have a surplus to where you can also help them out. If you are sick, you want to make sure that you stay home for at least 24 hours, even if you're feeling better. So if that fever from your cold or your flu goes away within a day or two, you still need to make sure that you stay home after that to prevent anyone else from getting sick. So you're not only taking care of yourself, but you're looking after those around you as well. The flu vaccine has come highly recommended, of course, by the CDC. There's a lot of different opinions, different stories, different takes, different points of view on the flu vaccine. But the people that it's most important for are those high risk individuals. So those who are in the elderly population, those who have underlying health conditions, and people who are in different healthcare fields. So those individuals are really the ones who would need to seek getting the flu vaccine, especially in this season with two different potent viruses basically being out there. For your children, you want to make sure, well, for the kids that are actually back at school and attending school, going into cold and flu season, it's important to kind of know how their schools are handling the outbreaks of the flu virus. So if they, have a plan for how they're going to be sending the children home, or how they're going to be shutting things down, whatever their plans are, you want to make sure that you're aware of whatever it is that the school is doing for your child. You also would want to ask about their cleaning routines. You can question what types of disinfectant products they are, and just educate your children. Make sure that they have the tools that they need. So teach them, like, even if their friends or their associates at school are not practicing the same measures that they are, such as carrying hand sanitizer, carrying wipes in their backpacks, or washing their hands throughout the day, they still should do it. They can be the leaders that they are in whatever age range and whatever capacity of schooling that they're in, and take leadership and do those things, because it not only helps them as a individual, but it also helps those around them. And the same applies to us working adults. Every day that you're going to work, you should have these things available. If you are having to go into the office, make sure you have your sanitizer in your pocket. Make sure you're carrying wipes with you, carry your spray if need be. Whatever it is that you can do to help keep yourself and others safe going into this cold and flu season. If you do feel like you are getting sick with the flu, you should also still, just as with COVID-19, self isolate and quarantine. And again, that is both for the cold and the flu. So typically, the cold and the flu don't last as long as COVID-19, but 5 to 7 days is the approximate recommended time for you to isolate if you feel like you have the flu after the symptoms start. There are also tests that are available for the flu, but I did want to make mention that getting the flu vaccine after your symptoms have already started will not protect you from, or will not help you rather, if you've already contracted the flu. So again, getting the flu vaccine after you've already contracted the flu will not help you. Now, in the case of someone who actually does have the flu, your body again does respond. You create antibodies against that particular strand of flu that you have, and those do help you or protect you in future cases. But that doesn't mean that you cannot contract the flu again, being that there are different strands of the flu virus itself. Tamiflu is a antiviral medication that's usually administered within 48 hours of someone who presents with symptoms of the flu. It's basically been shown to shorten the symptoms, or the timing that you would have the symptoms of the flu. So you normally would take an antiviral medication for about 5 days. Other ways that you can treat your symptoms, if you are outside of that 48-hour window and you haven't been to a physician to be able to get a prescription for Tamiflu, you can take regular over-the-counter pain and cold or flu meds. Um, but it is important that if it's your child that actually has the flu and they are under the age of 18, you do not treat them with aspirin. Aspirin has been known to cause basically a specific syndrome in children that are under the age of 18. So that's why it's important not to give that to them. Other things that you want to do is do as much as you can to build your immune system, which we'll go over some points about that later on in the presentation. And just like with COVID-19, make sure that you're resting as much as possible, stay hydrated. Some other important points: you can take warm baths or hot showers and use humidifiers. These help to keep your nasal membranes moist, and it also helps to create a better respiratory environment for you when you're going through being sick with the cold or with the flu virus. And just as with COVID-19, you only go to the emergency room if you're presenting with severe symptoms. I won't go through all of the severe symptoms of the flu, but I will just make mention, especially for children, having a high fever, which would be anything over, basically over 104 degrees Fahrenheit, is something that you would want to take them into the emergency room for. I mean, you know your children best, so if they're presenting with anything that's out of their normal, they seem confused, they don't want to walk, they seem like they're dehydrated, you want to make sure that you get them to the emergency room as soon as possible, preferably a pediatric emergency room, being that there are some emergency rooms that do not specialize in dealing with or treating children. For adults, some of the things that you want to watch out for are severe weakness. So if you're to the point where you just cannot even get up and walk because of the flu symptoms, then you want to make sure that you call 911 and get to the emergency room as soon as possible. So that way they can monitor you and know what's going on with you. So, overall, general health points for keeping yourself as well as you can going into this cold and flu season and dealing with this pandemic. You want to know if you are at high risk or if your family members or friends are at high risk. So, some of the high risk underlying health conditions include high blood pressure, which is hypertension, diabetes, which is high blood sugar, asthma, heart failure, dementia, um, chronic obstructive pulmonary diseases, any kidney failure, people who have sickle cell disease, if you struggle with obesity, or if you have a weak immune system from different conditions like HIV, if they have cancer, any of those types of conditions that weaken the immune system, they are considered high risk individuals. So these people are the ones that we really, really have to look out for going into cold and flu season. You want to make sure that you're staying active. So we kind of talked on this back when we did the diabetes workshop. You want to make sure that you're exercising at least 30 minutes for 3 to 4 times per week. You want to make sure that you're de-stressing and meditating, whatever that looks like for you. I mean, there's so many different techniques to de-stress. I mean, if you Google or even go on YouTube, there's a ton of literature about how to de-stress and how to even know if you're stressed. And for meditation, for us as believers, just praying and reading your word, sitting quietly, talking to God, whatever it is that helps you to calm down and to forget about things that are going on in life, forget about the pandemic, forget about COVID-19, forget about work stress, child stress, everything else that's going on. Focus on, in that moment when you take away time to just sit and meditate, focus on nothing but stress relief. You also want to eat healthy as much as possible. So lots of fruits and vegetables and drink a lot of water. Stay hydrated. You want to take vitamins. So multivitamins are really good. Doesn't matter what type of multivitamin. You can read the labels. I mean, a lot of them are very similar. But if you read the labels and compare, you can choose whatever you feel is the best for you. Vitamin C and vitamin D supplements are highly recommended during this cold and flu season, especially with the COVID-19 pandemic. These things are also being used in the hospital setting for patients that are critically ill. They both have good immune support booster effects. So, for example, vitamin D works on your bones, and within your bones, you have basically cells that are created to help your immune system, and they help to fight off different viruses and bacteria. Other herbs that you can take are ginger, turmeric, garlic, elderberry, fish oils, echinacea. There's so many. So if you want it to find like a whole complete list, it's a ton of them available on the web. Drinking tea or hot water with acidic fruits like lemon or lemon juice and honey helps to reduce phlegm. So if you are sick or if you struggle with even waking up sometimes in the morning and having to clear your throat a lot, drinking hot tea or hot water can help with that. Other types of immune boosters are probiotics, which a lot of these you can either find as like pill supplements. Some of them are made to be mixed into drinks. and you can also find them in like the dairy and yogurt sections. One of my favorites is called Dan Active. It's like it kind of tastes like a milkshake almost, but you can find it in like the yogurt section. Also, you want to make sure that you're not traveling if you don't have to in this season, especially with everything that's going on with the overlap of not just the flu, but also the pandemic of COVID-19. But if you do have to travel, make sure that you're doing it safely. Consider when you're traveling, are you going to be able to clean? If you're not going to be able to clean things down, then maybe you need to find a different method of traveling. Will you be able to wear your mask, or will you need to bring mask with you? Will you be able to create distance wherever it is that you're going, or even via your method of traveling? You want to consider, is a place where you're going to a epicenter or considered like a high population, high COVID-19 area or high flu area? And if you are someone who falls under the high risk category, is the person that you're traveling with someone who falls under the high risk category? And do you live with someone that's under the high risk category? So, you're not just thinking about yourself, but you're also thinking about those around you and who you live with. And then just follow up on the prevention points that are recommended, and stay out of crowds. So this is really, really important for our older population and for those who have underlying health conditions. It's important that, if you absolutely do have to go into a crowd, you're doing everything that you can to protect yourself by wearing your mask, or either, or even possibly, if it's a crowd that you can send someone else into for you. For example, sending someone else to the grocery store for you, or ordering in your groceries, and doing like curbside pickup. Those are just different things as like someone with the underlying health condition, what you can do to kind of avoid those crowds. So I provided some additional links where you can find additional details about COVID-19, different recommendations about what to do if you feel symptoms, how to care for those who are sick. There's, a ton of information, in which I didn't want to bore you guys with everything tonight, but there's also some links about the same things for the flu, and a couple of YouTube videos that I included that talk about basically how bacteria and viruses are spread on surfaces and how we pick them up, and also how stress affects your immune system. So they're really cool short videos, about maybe 3 to 4 minutes. Interesting watches. So that is the end of my presentation, and we're going to move on to our question and answer session. So you guys can unmute your lines, and I'll be happy to take any questions that you have at this time.
Dr. Dixon?
Yes.
Okay, I have a question. My first question is, are there different strains of the COVID-19 virus or the coronavirus?
Yes, there are. I'm glad you asked that question. So when everything first started, and they really started digging into the research, there were at least 2 different strains that were identified specifically for COVID-19. However, there's also like another subpopulation of different types of coronaviruses that each have different individual strands that cause other types of symptoms, like there's a strand that basically causes just a general common cold, and then you have another strand that causes another severe respiratory disease similar to COVID-19. So for sure, for pertaining to just COVID-19, there's at least 2 different identified strands.
Okay. And then my next question is, um, you had talked about something about cytokine. I think I'm cytokine. You said
Yes,
that if it
cytokine.
releases in our body, that it can really affect our lungs. So is there something that we can do daily to make sure that's not released in our body? Because we can get the coronavirus and not know we have it. So is there something we can do daily to make sure that's not released in our body?
Absolutely. The main thing that you want to do is follow those prevention points for staying healthy. So keeping the amount of inflammation that's going on in your body under control, that's especially important for people who have underlying health conditions because they already have a lot of inflammation going on from those health conditions. So just staying as healthy as you can with taking vitamins and staying active, those are different things that help to reduce inflammation in your body.
Okay, thank you.
You're welcome.
This is Ayana. I have a question. Can you speak a little bit more about the flu vaccine? I mean, it's been around for a while, and I think it is. I guess it still is. When you take it, you will get sick. You will kind of be down. It's almost like them injecting you with the flu. Is it just a guarantee that you will be down for a few days with the cold and all that type stuff? Can you just kind of explain a little bit about how that works?
Sure. So the flu vaccine is basically created from the flu virus itself. It's, however, like a weakened form of the influenza strains, so that it doesn't cause a huge immune response in your body. So usually the day of that you receive the vaccine, you may or may not, depending on how strong your immune system is, actually feel those things like weakness or maybe just a little bit of feeling fatigue or like down on that specific day. But typically those symptoms shouldn't last more than a day. If they do, then it may be that you have a different type of reaction going on to the vaccine. Like you may possibly have an allergy to it based
Mhm,
off of how the vaccines are created. I mean,
mhm,
there's different brands of the vaccines, and some of them are created differently.
mhm.
So it could also be that, wherever you went to get that injection, it could be that that specific vaccine doesn't doesn't work for you or doesn't comply well with your body. So even if you received the vaccine previously in prior years and you didn't have a good response to it, doesn't mean that if you go somewhere else and or if you have a different form of the vaccine injected, you'll have the same reaction to it.
Is it highly
Um,
recommended that we get the vaccine, or is it, if you feel like you're healthy, then don't worry about it?
so I kind of have a biased perspective on that one.
Okay.
If you feel like you're a healthy person and you know that you don't have any type of underlying health issues and you don't have to get the vaccine at all, and you're not around like a lot of children, you're not a school worker, you're not a healthcare worker, you're not somebody who has to be out and about with a lot of people or in a lot of
Mhm,
crowds
mhm,
continuously, then you may not, you may not need to get the flu vaccine. But if you are someone that is a frequent flyer and you have to be in a lot of crowds, or you have to be around a lot of people consistently, then it may be something that you want to consider. My personal experience with the flu vaccine, last year was my first year. No, not last year, the year before last. I apologize. 2 years ago was my first year having to get the flu vaccine, going into the healthcare industry, healthcare field,
mhm.
and completing like clinical rotations. And I was very fortunate to not have any of the signs of weakness, no type of reaction or anything like that to the vaccine. And I
Mhm.
actually had never experienced having the flu previously, even up before that point. So every individual is different. Your experience with it may be different than others, but you just kind of have to make a judgment call for yourself.
Okay.
Is this something that i I can risk in the long term, protecting myself, or is this something that I know I probably won't need because I'm going to do everything that I can in my power to follow all the guidelines and keep myself healthy during the like peak season of the flu?
Okay. Thank you.
You're welcome. Do we have any other questions?
Don't forget to press *6 to unmute your line if you have any questions.
Sister Nathan here. Can you hear me?
Yes.
Okay. Well, Ayana asked one of my questions, and like you, being a teacher, they encouraged us to get the flu vaccine, and I've taken it most years. And like you, I've never had any side effects from it. But I'd like to know, I have two questions. What about the COVID? If they come up with a COVID vaccine, do you mind sharing your personal opinion about that? And also, given your exposure to the medical community, you hear what they're saying, you read journals and things. What are they saying about how long this pandemic will last, and how long do we have to take precautions like we're doing? Because people are tending to slack up at the wrong times. Okay, that's it.
Okay. So, let's see. So going with the first part of your question, as far as the COVID-19 vaccine goes, there are tons of companies at this point that have patents and different things to work on trying to create a vaccine. I would say, just from research and what's been seen in the past with literature and other types of vaccines that have been rolled out, um, in the beginning phases, there can be a lot of kinks to work out. So I would stay, from my perspective, I would steer clear of getting the vaccine when it becomes readily available in the first stages, because in those periods, it's kind of like it's still a mixed trial versus mixed error period. So they're still like testing things, but at the same time, they're trying to get it very much pushed out to calm down the numbers in a sense. So personally, I think that, kind of waiting to see how things trend once the vaccine studies are coming more to like a finalized stage, once they have more people that have volunteered to do testing, or like, once they've completed those testing phases, then it'll be a little easier to really say, like, is this something that would be safe for people to take, or is this something that would be most beneficial for everybody, including those with underlying health conditions. So right now, I think it's still really early to make a judgment call on taking that vaccine, if they once they do actually come with a finalized perspective, I guess, on it. And then the second part of your question, see, you were asked, well, the second part of your question, you asked about how I'm sorry, how long the pandemic, or how long it's looking from a medical perspective that, we'll have to really take these precautions. It's really hard to say, honestly. When you look back at some of the other pandemics that have come and gone, like the one with the Ebola virus, or even like if you look back to SARS, which was one that basically more so affected children. It's really, hard to predict how long these viruses can stay around. A lot of it depends on the behavior of people. So how well people are adhering to precautions, how well people are not, for lack of better words, bucking against the system, and like, trying to be defiant against doing things that not only help protect themselves, but protect others. So that's basically what makes it difficult to really exactly say how long we'll be in a period of like really needing to take precautions, over precautions to protect ourselves. But going into cold and flu season, it's like it becomes even more important, because you have two strong competing viruses at this point that we're kind of coming into. Granted, the flu virus in past years has not been as much of a burden, because with the vaccines being developed and just treatments and things being developed, the numbers in terms of like how detrimental it is has calmed down a lot. But then when you get those two imposing things, and they both can predominantly affect the lungs, it's just like, it's a overwhelming I guess, environment that it creates within the body. And so that's why it becomes such a worry, basically. And being that flu season can last well into, let's say, February, March, sometimes even April, depending on how well it's contained. With COVID-19 overlapping on that, it may draw out, how long we're seeing COVID-19 around.
Thank you.
You're welcome.
Dr. Dixon,
Yes.
this is Mother Joyce. In your opinion, why are Black people more susceptible to get sicker with the COVID-19?
So that is a great question. From what most of the research has shown, it's like a combination of things. One thing is that ethnic people or African American people are typically more deficient in certain vitamins like vitamin D. They're more diagnosed with like vitamin D deficiencies and other things that help to build your immune system. So from that perspective, we kind of already are susceptible to having a weaker immune system. And then on top of that, with the not really lack of care, but just like with our culture and the way that we consume things, we tend to have a lot more underlying health conditions, such as like, dealing with diabetes, dealing with high blood pressure. And those things, like, they don't just affect your, they affect your overall body. So they affect all of your organs, like your kidneys, they affect your liver function, they affect how well your heart functions. And those are like, your predominant organs that really control how your body responds to things. So being that our people tend to deal with those things on a higher level than some non-ethnic people, it kind of puts us at a higher risk for not just COVID-19, but like other things like the flu virus.
Okay. Thank you.
You're welcome. Are there any other questions before we wrap up for tonight?
Sinai,
Yes.
hi. To piggyback off of Mother Giuseppe's question, is it also true that the virus affects African Americans and other people of color because I guess lack of health care itself, and African Americans, some tend to not go get checked out when they see symptoms and different things. We kind of are passive. Some of us are kind of passive and say, well, it's nothing, I'll be okay. And many, or I guess homeless people of color and don't have the health care insurance available to go get exams and things. Is that also contributing to the higher numbers of African Americans and other people of color being affected more by COVID-19?
Absolutely. Even down to having more underlying health conditions. That is a huge impactful thing as far as why we have more underlying health conditions, is because for some reason there's this stigma of like, people don't want to go to the doctor, people don't want to seek medical attention, or like you mentioned, they don't have the necessary means. Like there's a huge shortage of healthcare. There's a huge shortage of healthcare funding in general within the United States, and it unfortunately really impacts people of color. And I know from personal experience, even going through like different rotations and internships within the hospital setting and just doctor offices in different locations, you know, it was really sad to see that sometimes people would really come in like just, and people of color specifically would really come in sometimes with this lackadaisical approach about their health. Like we could counsel them, we could educate them, and yet and still they don't or would not comply with some of the things that were recommended, even simple things like simple steps to just try and take to better their health or to take or to prevent them from worsening their health and their health conditions. It was like pulling teeth sometimes. And I don't know if it's like a cultural thing, like something that has just kind of developed over time. But then kind of tying into that, we also tend to be more religious people. And so, like, you know, while yes, you have to keep your faith and put your faith in God and put your trust in God, sometimes people confuse that with still being wise and, you know, taking the education and the tools that are being made available to them to apply to their health. So, you know, I always go to the common quoted scripture that faith without works is dead. And I'm an avid believer of that. Like, you know, you have to have your faith, but you also have to put in the work to care about, you know, what's going on with your health and your body as well. So yes, you brought up a really, 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 really good talking point there.
Okay, and one more thing that has been noticed in our culture and community is the I don't want to find out syndrome. You know?
Right, yes.
They rather not know. You know something is not right, but they rather not know. And then by the time they find out, it's progressed sometimes to a point of no return.
Right.
So we do have to drop that I rather not know mentality.
Right, absolutely. And from firsthand experience, I can tell you as healthcare providers, like I feel like it's a battle that we have to fight against. You know, to try and keep people healthy, or even to try and help to prevent things from happening to them. Like, you know, we can only do so much, and you have to kind of have that willingness to do a little bit as well for yourself. And so that mentality of like, you know, I don't want to find out, it kind of like fights against some of the chances or some of the opportunities that have been presented, like, you know, beforehand to try and catch things early on. That kind of ties back into some of the stuff that we talked about, I think, in the diabetic workshop, just in regards to like screenings and making sure that you are getting the proper screenings and things throughout, you know, at the recommended ages. So yes, I 100% agree with you about that point.
Dr. Dixon.
But,
Oh, I'm sorry.
no, you're good. I was just going to say thank you, Dr. Dixon.
You're welcome.
Dr. Dixon, I thank you, and I thank all the panel for asking some very good questions. There's never a dumb question, and I thank you all for it. Dr. Dixon, I wanted to ask to confirm, you mentioned earlier about eating a good diet and a proper diet for an elderly that is considered high risk and don't care to eat as much. Do you have any suggestions or advice or some things that we could do or substitute for eating in order to get those nourishments that is needed to help build that immune system and to keep that regimen going?
Oh, absolutely. The best things like are to try to get them to drink. I don't know if you've ever heard of like those protein drinks like Ensure or Boost. Those
Yes.
are what we usually use with our elderly patients, especially in a hospital setting if they aren't eating or they're not doing well, if they're like chronically ill or just don't have a good diet tolerance, we usually we provide them with those types of supplements, those drinks. They're really, really good for them. So if you can get them to at least take an Ensure or drink a Boost, those are really, really good things to basically make sure they're getting all the same amount of nutrients that they would be in a good, healthy, balanced meal.
Thank you so much.
You're welcome. Okay, are there any more questions?
Dr. Disson, I just wanted to say thank you so much for taking this time to impart your wisdom into us. Something sometimes we can't even get this from our doctor. So thank you for taking the time to answer our questions.
Absolutely. You are more than welcome. I'm honestly, like, I count it an honor and a privilege to be able to share as much information that I've learned with you guys, and just be able to pour back into everyone the tools and different helpful points that I've learned, not only through like education, but just through firsthand experience of being in the hospitals. And I've absorbed as much as I can, so I'm happy to share anything that's helpful and trying to keep our people especially healthy and thriving. And I'm always available, so if there are any questions even after tonight's session, if you're ever worried, concerned about anything from a health perspective, I mean, feel free to reach out. I'm always available. So if you don't have my contact information, you can reach out to Sister Laterica Hillary, our church administrator, and you can get with her on how to contact me. So I'm always available, and I'm happy to answer any additional questions even after tonight's session. I know that the information has also been made available on our church website, so you can always refer back to it. In the notes section of the PowerPoint, being that I use some acronyms and shorthanded words throughout the presentation, there's expounded like definitions and just meanings of what certain things in the PowerPoint are, so that way you can refer back to that as well in the notes section. But if you have any additional questions or anything, again, feel free to reach out and ask.
Thank you.
So that concludes our presentation for tonight. Thank you so much for having me and for listening. Thank you for all the questions. I feel like all of the questions were super awesome and definitely beneficial, not just for one person, but to everyone. Because I mean, again, these are things that affect everybody, people of all ages. So the session was applicable to everyone tonight. And I'm going to turn it back over to the hands of Sister Ayana Nathan.
All right. Thank you all for attending tonight's session. We had great attendance, great questions. We hope you all enjoyed the seminar. This is available on our YouTube channel for True Holiness Deliverance Tabernacle. So please, if you need a copy of it, you can text me and I'll send you a copy to share. But please share this information with family and friends. This is valuable information we got for free, as Pastor Nathan would say. So thank you all again. And that concludes our session for tonight.